Meningococcal disease is a bacterial infection. It spreads from person to person through close and prolonged contact, for example, between people who are living together or through kissing. It can cause sepsis, which is blood infection, and meningitis, which is inflammation of the lining of the brain and spinal cord. It is a serious infection and requires emergency medical attention. 5 to 10% of people with meningococcal disease will die, even with rapid treatment. Complications of meningococcal disease are common and include limb deformity, skin scarring, deafness, and neurological deficits. Children younger than 2 years have the highest incidence of meningococcal disease. Adolescents and young adults are also at increased risk compared to the rest of the population. The symptoms of meningococcal disease can vary from person to person, depending on whether they have sepsis or meningitis. Children with sepsis might have fever and a rash with bruises, and they might be drowsy. Children with meningitis might have fever, headache, vomiting, irritability, drowsiness, or a stiff neck. Some people also have cold-like symptoms initially. If your child has concerning symptoms, go to the emergency department urgently or call 000. Early treatment can prevent severe complications such as loss of limbs, loss of hearing, or vision or brain damage. There are different meningococcal disease vaccines available in Australia. The vaccine funded under the National Immunisation Program at 12 months and 14 to 16 years of age is a combination vaccine that protects against 4 strains of the bacteria. These are called A, C, W and Y. Parents can talk to their immunisation provider about recommendations for other meningococcal vaccines. The meningococcal vaccine on the National Immunisation Program provides immunity to meningococcal strains A, C, W and Y to help prevent your child from getting the disease. It contains inactive proteins from the bacteria to train your child's immune system to recognise and fight the infection. Over 97% of children who receive a single dose of the ACWY vaccine at 12 months of age will develop a protective immune response. The vaccines do not protect against all strains of the bacteria. Therefore, there is still a possibility of contracting the disease. Some children experience mild side effects. Common reactions include swelling, redness, or pain at the injection site. They can also develop a mild fever and appear unsettled. Serious side effects are extremely rare. Since we started vaccinating against meningococcal disease in 2003, it has significantly reduced the number of cases in Australia. Cases have further reduced since the combination ACWY vaccine was introduced in 2017.